Welcome to PCR London Valves 2024. My name is Dr. Ashok Seth from New Delhi, India, and I have the pleasure today to be with Professor Patrick Serruys from Galway, Ireland.
Here.
Professor Serruys, you well know, is an avid researcher, a leader for a long time, known him for ages, and of course, more recently, he's been the chairman of important trials which were presented at the PCR London Valves.
Yeah, that's correct. Ashok, two important trials. The first is the landmark trial. As a matter of fact, the primary endpoint was already reported at PCR, but in Paris and published in the Lancet. What we did here is that initially that was the technology from India, the so-called Myval series versus the Sapien series and the Evolut series. But it was pulled together. It was a combined contemporary golden standard technology from India versus these two. And already at that time we showed non-inferiority. But here in London we have shown the comparison individually versus the Sapien series and versus the Evolut series. And the news is good in the sense that versus the Evolut self-expanding, there was a difference of 5.1%. We were aiming just at non-inferiority achieved, and also versus the Sapien series with a minimal difference of 0.6%. So that's great news for that technology. The second important communication here in London was Compare TAVI. Compare TAVI was an investigator-initiated trial, and they had more than 1,000 patients, and they were specifically the Myval series versus the Sapien series. The trial was for some time interrupted, so they moved from the first iteration to the second iteration, and they come with unbelievable result. So it's very important. I mean, I've been impressed by the technology coming from India.
Yeah, thank you, Patrick. You see me smiling because I feel so proud that you talk about this technology. But yes, I think it was important also to point out that landmark was a 30-day data of non-inferiority, and now we have a year data of non-inferiority, and I think that's really a robust aspect of.
On your side, I would like to ask you a question, because we see that technology evolving quite rapidly. I mean, used to change in technology, but the pace, which is the pace actually of iteration 1, iteration 2, iteration 3 is impressive. Can you comment on that? Because you are a user, a customer, you know how to do it, and you have seen the technology in your hand.
Yes, Patrick, and been a part of it. One of the interesting aspects of this valve, of course, as we iterated, is still the fact that we have a variety of sizes to fit every anatomy, 9 sizes with the extra large size. I think that's a unique feature, I would say.
Yeah, I was talking about the clinical outcome, and you're right by saying it's 30 days and 1 year. But I think that the intermediate size, as we said, make the life of the operator easy. He can really select the fitted valve for the anatomy.
Right.
And we have created that fitting index, and it's clear that when the things are fitting properly, the results are superior. So we were very surprised to see a better effective orifice area opening of the valve with the technology coming from India versus the classical gold standard of Sapien.
Yeah.
And the gradient was also lower. So that's really a great point in terms of hemodynamic, the question, the impact of the long-term durability.
You're absolutely right, and therefore the iteration now has to focus on a lifetime management of our patients, and therefore two things come important in our mind in terms of iterations. The ones which we're working on, Okhla Pro, for example, ability to align the valve, commissural alignment is an important aspect in our minds for every patient that we treat.
Yeah, I think it was a great idea to do the alignment outside the patient and then introduce the device and have the alignment inside the patient without depending on fluoroscopy in the first place, although you can control that you have done the right alignment. So the alignment is also part of our history now. I mean, everybody do that. And it's very important, of
And
course.
so Octacore has been now tested in a way, should we say, in compare TAVI. And the next iteration, of course, has to be on precise placement of the valve, what we call decreasing the foreshortening. And I think this move to OctaPro, which was launched here, and we had a great session around the OctaPro, is a move forwards. I mean, isn't it fascinating for a valve to only shorten by 10% and not visibly shorten on fluoroscopy, enabling precise, perfect deployment of a valve, accurate deployment of a valve, position it where you want, and then just to deploy it in a short frame, thereby having coronary access for the future. And
you know, in the attendance of PCR London, you have, of course, people who have a long experience with that technology, but there are still people who have to start. And I got a question just coming out of the session. Is that the valve I should use to start? I found that a very good question. So I think that we have achieved our goal by exposing in trial and in technology what is achievable today and what is available today.
Yeah, and I think these results are resilient, they are robust, and I think they truly serve as a testament to science, serve as a testament to innovation, and serve a testament to patient outcomes in a very scientifically robust manner which stands the scrutiny of science, I would say. And I think finally, one says these iterations, the developments of science need to continue out from India and out from these companies who really are looking to prove that they can have a valve which is now competitive in the present atmosphere for the patients, and we have a choice now.
It's for the benefit of the patient, and we are there to stimulate that so that the progress never stops in the industrial partner, with our industrial partner.
Thank you, Patrick. It's great to talk about this, the two trials. It's great to talk about the Myval transcatheter heart valve series and the iterations of OctaPro, and the way this is going. Our goals of lifetime management of a patient who has TAVI need to be met with future innovations and novel ideas. Thank you very much, Patrick, for being a part of a great science and great research.